Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Medical Terminology MCQ series, Chapter 1, Integumentary System, Part B, Diseases and Conditions. Question number 1. Which of the following terms specifically defines a fungal disease affecting the fingernails or toenails? A. Trichomycosis, B. Koilonychia, C. Onychomycosis, D. Dermatocalasis. Think the answer. The correct answer is C. Onychomycosis. In onychomycosis, onych means nail, myco means fungus, osis means abnormal condition. When you check other answers, koilonychia is a spoon-shaped depression of the nail. Trichomycosis is a fungal infection of the hair. Dermatocalasis is an excessive skin typically of the upper or lower eyelid. Question number 2. Inflammation of a sweat gland is known as which of the following terms? A. Colitis, B. Fasciitis, C. Hidradenitis, D. Pymelitis. Think the answer. The correct answer is C. Hidradenitis. The term hidradenitis means inflammation of the sweat gland. Hyd is a root meaning sweat. Adin is a root meaning gland. Itis is a suffix meaning inflammation. Question number 3. Trichiasis is A. Fungal infection of eyelashes, B. Trichomonal infection of eyelashes, C. Lice infestation of eyelashes, D. Ingrowing or misdirected eyelashes. Think the answer. The correct answer is D. Ingrown or misdirected eyelashes. Trichiasis is a condition where the eyelashes are misdirected and grow inward toward the eyeball, which can irritate the cornea. Trich means hair or eyelash. The suffix iasis means a morbid condition or process. Question number 4. Where would a subungual hematoma be located? A. Mouth under the tongue, B. Under the toenail or fingernail, C. Scalp, D. Under the rectum. Think the answer. The correct answer is B. Under the toenail or fingernail. Subungual hematoma is a condition of blood under the nail. Sub means under, ungual means nail, pertaining to nail. Hematoma means a localized collection of blood outside of blood vessels. Question number 5. Impetigo is best described as A. A dry, scaly condition of the skin, B. A bacterial skin infection, C. A severe itching, D. Acute eruption of vesicles along the path of a nerve. Think the answer. The correct answer is B. A bacterial skin infection. Impetigo is a common and highly contagious bacterial skin infection, usually caused by Staphylococcus aureus or Streptococcus pyogenes, that primarily affects infants and children, presenting as red sores that quickly burst and form a yellowish brown crust. Question number 6. Oil gland in the skin is also known as A. Sebaceous gland, B. Eccrine gland, C. Apocrine gland, D. Merocrine gland. Think the answer. The correct answer is A. Sebaceous gland. Sebaceous gland is a small gland in the skin that secretes an oily veximeter called sebum to lubricate and waterproof the skin and hair. Eccrine and apocrine glands are types of sweat glands. Merocrine is a type of glandular secretion process often used to classify eccrine sweat glands. Question number 7. A blister or fluid-filled sac, typically less than 5 mm in diameter, is called A. Macule, B. Papule, C. Vesicle, D. Pustule. Think the answer. The correct answer is C. Vesicle. You can see in the picture, vesicle is a small circumscribed elevation of the skin containing serous fluid, often collectively called a blister. A bulla is a larger vesicle over 5 mm. Macule is a flood discoloration. A papule is a small solid elevation, and a pustule contains pus. So, in this question, the correct answer is C. Vesicle. Question number 8. The medical term for localized severe itching is A. Urticaria, B. Eczema, C. Pruritus, D. Alopecia. Think the answer. The correct answer is C. Pruritus. Pruritus is the medical term for symptom of itching. Urticaria is hives. Eczema is a chronic inflammatory condition, and alopecia is hair loss. So the correct answer is C. Pruritus. Question number 9. An acute eruption of painful vesicles along the path of a nerve caused by the herpes zoster virus is known as A. Cellulitis, B. Psoriasis, C. Shingles, D. Scabies. Think the answer. The correct answer is C. Shingles. So you can see the shingles here. Shingle is the common name for the herpes zoster. The term describes the characteristic unilateral rash following a dermatome, that is the nerve path. This follows the nerve path. Question number 10. The condition characterized by chronic skin inflammation with silvery scales and red patches is A. Dermatitis, B. Psoriasis, C. Vitiligo, D. Erysipelas. Think the answer. The correct answer is B, psoriasis. You can see here, psoriasis is a chronic autoimmune condition causing rapid skin cell buildup resulting in thick silvery scale patches. On the other hand, dermatitis is a general skin inflammation and vitiligo is the loss of skin pigment. Question number 11. What is the term for a contagious skin disorder characterized by burrows, intense itching, and papules caused by a mite? A. Impetigo, B. Scabies, C. Tinea, D. Melanoma. Think the answer. The correct answer is B. Scabies. You can see the scabies rash here, that mite burrows. You can see here. So scabies is an infestation of the skin by human itch mite that is called Sarcoptes scabiei, which burrows into the skin causing severe itching. On the other hand, impetigo is bacterial and tinea is fungal. Question number 12. Loss of hair, especially from the head, is medically termed A. Keratosis, B. Alopecia, C. Hirsutism, D. Tinea capitis. Think the answer. The correct answer is B. Alopecia. Alopecia is the medical term for hairless or baldness. On the other hand, hirsutism is excessive body hair growth. Question number 13. The medical term for athlete's foot, a fungal infection of the feet, is A. Tinea cruris, B. Tinea corporis, C. Tinea pedis, D. Candidiasis. Think the answer. The correct answer is C. Tinea pedis. Tinea pedis, pedis is foot, is a medical name for the athlete's foot. Tinea cruris is dog itch. And Tinea corporis is a ringworm that is all over the body. Question number 14. The condition characterized by patchy loss of skin pigmentation resulting in white spots is A. Albinism, B. Melanoma, C. Vitiligo, D. Scleroderma. Think the answer. So it's a tricky question. You can confuse with A and C, but here his answer is C. Vitiligo. Vitiligo is a disorder in which the melanocytes, that is the pigment producing cells, are destroyed, causing areas of skin to lose color. On the other hand, albinism is a congenital lack of pigment. Question number 15. A malignant tumor of the melanocytes, that is pigment cells, is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Seborrheic keratitis, D. Melanoma. Think the answer. The correct answer is D. Melanoma. Melanoma is the most serious form of skin cancer arising from the melanocytes. The other two choices, that is basal cell carcinoma and squamous cell carcinoma, are also cancers but originate from different skin cells. Question number 16. Inflammation of the skin due to an allergic reaction or irritant is known as A. Dermatitis, B. Erysipelas, C. Hidradenitis, D. Cellulitis. Think the answer. The correct answer is A. Dermatitis. Dermatitis is a general term for inflammation of the skin. Contact dermatitis is a specific type caused by the irritant or allergen. Question number 17. A bacterial infection of the dermis and subcutaneous tissues, often causing red, swollen, and painful skin, is called A. Impetigo, B. Cellulitis, C. Tinea, D. Herpes. Think the answer. You can see the difference here. The cellulitis is a serious bacterial infection that affects the deep layers of the skin. Impetigo affects the superficial layers, and tinea and herpes are fungal and virus respectively. Question number 18. The formation of a thick, hardened area of skin, often due to friction or pressure, is called A. Keloid, B. Lichenification, C. Callus, D. Excoriation. Think the answer. The correct answer is C. Callus. You can see there are two types of skin thickness. One is cone, other one is callus. The callus is a thickening of the epidermis caused by repeated friction. On the other hand, lichenification is thick leather-like skin from chronic stretching, and keloid is an overgrown scar tissue. Question number 19. The medical term for a mole, a benign pigmented lesion, is A. Verruca, B. Nervous, C. Seborrhea, D. Plaque. Think the answer. The correct answer is B. Nevus. A nevus is the medical term for a common mole, which is a benign growth of melanocytes. Verruca is a wart, and plaque is a raised, flat-topped lesion larger than a papule. Question number 20. A collection of pus beneath the skin, often large and painful, is A. Abscess, B. Pustule, C. Vesicle, D. Nodule. Think the answer. The correct answer is A. Abscess. An abscess is a collection of pus, that is dead white blood cells, bacteria, and tissue, that has accumulated in a cavity formed by the degeneration of tissue. On the other hand, pustule is a much smaller superficial lesion containing pus. Question number 21. The patient is diagnosed with trichomycosis. The patient has A. Skin tumor, B. Fungal infection of hair, C. Diffuse skin, D. Inflammation of nail and nail bed. Think the answer. The correct answer is B. Fungal infection of hair. Trichomycosis is a fungal infection of the hair where trich means hair, myco means fungus, osis means abnormal condition. Question number 22. A cephalocaudal assessment goes from A. Front to back, B. Side to side, C. Toe to head, D. Head to toe. Think the answer. The correct answer is D. Head to toe. Cephalocaudal is a directional term used in medicine and anatomy. Cephalo means head, caudal means tails, or in human anatomy towards the tail or feet. Therefore, the cephalocaudal assessment progress from the head to toe. Question number 23. Excessive growth of hair in unusual or masculine patterns is called A. Trichorexis, B. Hirsutism, C. Hypertrichosis, D. Alopecia. Think the answer. The correct answer is B. Hirsutism. Hirsutism especially refers to excessive coarse hair growth in women in a male-like pattern due to hormonal factors. On the other hand, hypertrichosis is a simply excessive hair growth anywhere. Question number 24. What is the term for inflammatory condition of sebaceous glands and hair follicles typically seen as pimples and blackheads? A. Rosacea, B. Acne vulgaris, C. Seborrhea, D. Impetigo. Think the answer. The correct answer is B. Acne vulgaris. Acne vulgaris is a common inflammatory disease involving the oil, that is sebaceous glands of the skin. On the other hand, rosacea is a separate chronic facial redness condition. Question number 25. Excessive sweating, often localized or generalized, is known as A. Anhidrosis, B. Diaphoresis, C. Hypohidrosis, D. Xeroderma. Think the answer. The correct answer is B. Diaphoresis. Diaphoresis is the medical term for profuse sweating. Anhidrosis and hypohidrosis refer to the inability to sweat or reduce sweating, respectively. Bonus question. A raised fluid-filled lesion larger than 5 mm in diameter is A. Wheal, B. Nodule, C. Bulla, D. Vesicle. So think the answer and leave your answer in the comment section. If you have any questions, leave in the comment section. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me or you can WhatsApp me. So please subscribe my channel and stay with me. Thank you.